Hello and welcome, dear viewers. This is our weekly edition, ATV Special. And here I am Zalalem Ibeltal, your host. Since the outbreak of coronavirus COVID-19 in December 2019, the world has been moving in an extraordinary manner. Schools are closed, clubs are shut down, flights or the general transport sector is much restricted, conferences are being conducted online, and many more. These are all done to halt the spread of the virus. Ethiopia, as a part of the greater world, is also not immune from this pandemic, coronavirus COVID-19. The country has been taking series of measures, including the recently lifted state of emergency. However, still the war against COVID-19 is not over. So how we come through this stage and what should be done in the future? Communication is the most important element in the fight against such pandemics. How we communicate really matters. We have witnessed in Ethiopia that some people are not recognizing or accepting the very existence of the virus, and some others are minimizing the impact of the virus, and some others are also obsessed about the pandemic. These are all the impact of communication. Dear viewers, today's ATV Special circumnavigated around our communication on coronavirus. For this, I have invited two gentlemen. Both of them are PhD students in the University of Bahar Dar. Welcome to ATV Studio and thank you for joining us. How you wonder the significance of communication during the time of crisis like COVID-19?
The role of communication in time of crisis such as pandemic and the coronavirus over this world is very vital. First, communicators try to inform, tell what are the impacts, the negative consequences that this such pandemics create on society, on usual community lives. So we have to give enough information what it is about. COVID-19 was a new virus, unusual virus.
Sure.
So people do not know any information about it. So there were a need of information to be understood about the behaviors, the way of transmissions, and how we can deter it. So the role of communication is all about how to survive from this virus. It's about how to retain the expansion of the virus. So it's a vital issue than any other deterring mechanisms. The communication is the very center issue in addressing pandemics, in informing the society to help themselves, how to they save families, how to they try to continue generation post the pandemic. So some scholars said human being cannot not communicate. Communication is a sign of life. Next to a movement, unless people communicate, we can't say they are alive. If people are under coma, the first thing they stop is communicating. So it is a sign of survival, a sign of life. So communication in any aspect, including deterring pandemics, is essential and to be considered by stakeholders such as the media, the government. So it's essential to be addressed.
Almost more than 95% of our health policy we are following the prevention strategy. When you say about prevention, we are just focusing about communication. So communication is from the very beginning, our policy give much emphasis about communication. So in relation to our health issues, especially, most of our health problems are endemic problems. like
Endemic.
endemic problem, epidemic problems, like, for example, what we are looking today, COVID-19, and the rest we are putting in our health policy package. We call it the 16 health packages. Most of those health problems are endemic, so epidemic, sorry. So for those problems, we have to teach our community, our peoples, how they tackle those problems. So we give much emphasis about for communication. As Mulukan mentioned that communication is about everything. We cannot move from one place to the other, or we cannot do anything without communication. For example, what we are looking in COVID, most of the peoples are getting information from what you call WHO or Ministry of Health in our context, or Ethiopian Public Institute. Those are our source of information, so that instead of just searching about the mechanism or the final output, we are focusing about communication. So the role of communication, just we are enhancing, awareing in order to positively influence our community to save their life from those epidemic.
Day by day, informations are being released both on mainstream and social media, and some informations are negating the previous informations. So don't you think that such kinds of informations are affecting the way people struggle against the coronavirus?
Sure, it affects how the people react against the pandemic.
Yeah.
Because there was practice of overloading information from different directions.
Information saturation.
Yes.
Yeah.
Very loaded and bulky information was coming from any direction, from individuals, institutions. Some are unauthenticated and unofficial. So people confused to trust which information to trust. Societies like Ethiopians are traditional societies which believes personal communications and media or scientific informations. Much of the population live in the rural area. There is no access to mainstream media, so they try to depend on family information, neighborhood informations, personal informations. So the information, when it is transmitted from the mainstream media or from officials to the second receiver of the information, it may distort it. It may contain the form. It may contain misprescriptions. So that's overloading information, and the peoples we live in as a traditional society negatively affects how to deter the pandemic. In the case of Ethiopia, I think we know that more than 60% of society do not access electricity. It does mean they don't access mainly the mainstream media. They are restricted to personal communications. But much of the campaigns against the pandemic was done in the urban, the cities. But some of the majority of the society was neglected. They were out of the channel of the communications. Having that, in the city, the social media, personals, activists, and officials, there were contradicting informations.
Yeah.
Some beliefs, some beliefs that they deny the existence of the virus. Some consider it as a conspiracy theory that the government created, a bio weapon that the government is intended to decrease the population size. Because all this comes because the information is unclear, confusion, and contradicting. And the communication was not managed or regulated. Because of that, people's reaction towards the pandemic was so difficult.
There is huge information, bulky information from different sides of the world.
Yeah.
For example, as we start from the very beginning, we remember that most of the people are running from quarantine side around the village.
Sure.
Because of information. Yeah. Even the informations are not, I think, what we call guided by some principles or some rules or some regulations. Everybody just put on the media, on the interpersonal, on the social media, different information about COVID.
Yeah.
Because of that, since we got information from different source, we cannot just tolerate even the COVID. Rather, we just fear at the very beginning of COVID. For example, do you remember one? I think one story or one example. One guy from he running from Addis to somewhere around in Waldo. Yeah, do you remember that story?
Yeah.
That was also the source of information. We got even. We don't have the exact source of information at the very beginning, like Ministry of Health or Ethiopian Public Institute or WHO. We got from different sources. Because of that bulky information, we cannot just tolerate about COVID. That was a very challenging problem, especially in our context.
Irrespective of who says what regarding coronavirus, COVID is real and it's with us, killing us. So, do you think, Haimanot, do you think that Ethiopia effectively communicate the disease to the people?
Okay. There is research which has done by Ministry of Health as well as Ethiopian Public Health Institute related about the level of awareness about the whole the Ethiopian context, taking I think a sample around 80,000 peoples, and the research shows that almost the awareness level is arrived around 18%, 0%. But there was information dissemination in every aspect. For example, take the Ethiopian telecommunication, disseminating through your phone, texts, voice messages. There was a big dissemination of information, but even though there is awareness creation related to perception, related to behavioral change, related to attitude, it was very less. Almost 25% of the peoples are under perceptions. They are negatively perceived. For example, it is taken by the government in order to decrease the number of the population for our Ethiopian, or it might be tackle the problem by using traditional medicines like lemon or garlic. Those are the people's perception. But related to the awareness, almost we can say that almost more than 60%, 60 million people, because almost in Ethiopia more than 60 million people are using mobile phones, so they can access information. Even every media outlets, let's say television, radio, even social media, are disseminating information, and people have the information. But the very challenge is about the perception and the behavioral change. Still, people are lived, especially in the rural area. We can tackle the problems by using traditional medicine like garlic or lemon. That's we see here about the behavioral change is still less, but the information is I think addressed in every corner of our country.
I think we have to acknowledge the effort of the media, volunteers, and government officials to inform the society widely. There were wide campaigns to inform the society. Because of that, awareness was high. As Haimanot mentioned, that the research done by Ministry of Health and Ethiopian Public Health Institute indicates that 80% of the society they address have the awareness, have the information about how the virus transmitted to others, how they can catched by the virus, but their perception to be caught by the virus was less. Because communication needs, it's a progress. It needs a sustainable progress to bring effect. So the first step in communication is awareness. So in terms of creating awareness, I think we have to acknowledge the media, we have to acknowledge the officials, the government engagement, and some government institutions, including the institutions, the non-governmental institutions. So awareness was good. Creating in terms of providing information was good. But in order to bring behavioral change, it needs time. People will not give up their previous attitude towards certain issues in a simple way. It takes time. They need to be persuaded. So that takes time. But corona is a new virus that comes within, I think, 6 or 7 months.
Yeah.
So people stayed with some beliefs about their health. So they can't simply change their behavior, their trends, their cultures. So when you evaluate it as an effective communication, we may say that there is a gap, because to say effective communication, the outcome should indicate that there is a change. There is a change, but the virus expands. So we know that almost now 16.7 and more than that, thousands of people are caught by the virus, and more than 1,000 is dead. So day by day, the rate of people that are caught by the virus is increasing. But it doesn't mean there is a commitment done by concerned bodies. It's done, especially the media try to do a lot of things about the virus. There is a huge campaign, including the media and programs and outdoor communication using megaphones and other means. But behavioral change needs times. So to evaluate whether the communication we follow was effective or not, I think it needs time, one. The other, there should be a reassessment research.
We should appreciate about what the media is doing, especially our television stations. All the television stations are doing something good. But from the very beginning, to say about whether the communication is effective or not, we have to look at about the communication strategy. As I told you before, here in Ethiopia, we don't have health communication strategy. Look at, for example, the East African or other West African countries, Ghana, Nigeria, and South Africa. Almost those are best experience have their communication strategy. They don't focus whatever any kind of endemic disaster happen. They already have the policy, the strategy, and the plan. But here in Ethiopia, when COVID is coming, we are just raising everything. We try to just put our communication strategy from different perspective. That was from the very beginning our wrong side. But look at also what the media were doing. For example, some media, especially the television stations, are doing a funny video. So people are playing with those videos instead of just understanding about the riskiness of COVID. They simply dancing with music. They simply funny those videos. So that was unregulated media message. It should be regulated by Ministry of Health. From the very beginning, that was one challenge. The same is true, for example, we can see what the people is doing under the grassroots level. We can categorize the communication, urban and rural people. For the urban, especially the television and the radio are a very important role over there. But related to the rural side, the interpersonal communication has a big role. Rather than for media, religion leaders, opinion leaders are playing a major role, especially addressing the information for the target group. So those are the information flow. But related to the effectiveness, as I told you before, the challenging issue, what Mulukan has mentioned, needs a research, but still we observe that we can see what Ministry of Health and Public Health Institute is doing. Still their perception, their attitude, their behavior is low. Even though behavior needs about time, attitude needs time, and the perceptions too.
How do you see the culture of our people in accepting information regarding COVID? Do you think our culture is fertile?
The world was trying to teach itself about the virus. So as part of the world, Ethiopia itself was trying to acquire information from different sources. so even the experts, the health experts, were not sure about what comes next about the virus. New research findings indicate different outcomes about the virus from that differ from the initials. So, as a traditional society, most Ethiopians rely on personal communications. So we are a cumulative society that has that our lives are more shared lives than individualistic. We are a collective society. Because of that, many of our societal practice needs gathering, like we can say wedding ceremonies, funeral ceremonies. If you see how we can go to church, we go in group. So many of our practice were the most challenging issue to deter the virus, I think, than the wastes. Where the Westerns are more individualistic than Ethiopians or Africans. So our way of life is very, very challenging situation against such pandemics because our life is interdependent. So every of our movement is a collective movement than an individualistic movement. So that's why I think the government tried to, for example, bring some services to home, like religious. The service was transmitted live to home because they try to address some of the questions, the traditional practice of the society. And the government tried to, for example, disperse markets, huge markets like Addis in. And some gatherings were prevented not to happen. So all this was done because our life is so unsuitable to prevent the society than other world. So our culture, I think, somewhat was the most challenging issue for, especially for Ethiopians than any other world. As Haimanot mentioned earlier, some of society believes that they can prevent the virus from by traditional medicines like using garlic or using lemon, or some may prescribe any other list of vegetables. It can be fruits. It can be, but all those were not scientifically proved. So our society was somewhat challenging to accept scientific results. They trust their society than the media or official informations. So there were, I think, police and tips play. Okay, the government tried to save some part of practice of the society, but the society tried to hide themselves and practice as usual. So that was, I think, challenging. It is a challenge.
There was the same as I told you before, a research which has done shows that almost half of the people, especially the target group sampling from the research, shows that almost more than half is talking about a traditional medicine. This is related to culture. Not only COVID, by the way, but also for other health issues. Culture is, for example, for Ethiopian, a challenging issue. Most of, as Mulkan mentioned, most of our life is collective life. We live together, we do something together, we eat together. So because of COVID, we cannot just disseminate or isolate yourself from your family or from your neighbors. That was a very challenging issue. Most of the people, especially the rural peoples, believe that they got the information is absolutely true from their community leaders, from their religious leaders. So they cannot trust, most of the people are not trust scientific result, especially related to COVID. So this is one challenging. Most of the, for example, most of, as Mulkan mentioned, during, for example, a ceremonial program, most of the people are not isolate themselves from that program. They always go to the ceremonial program. That was a big challenge, especially related to cultural issues. Even from our context, we cannot have we are not have just a communication strategy based on different cultural perspective. For example, here in Ethiopia, we have a number of cultures. We have different cultural perspective towards a certain issue. So when you're designing for a communication strategy, we have to follow the culture. So we have to start from the grassroots level. So challenging problem from the very beginning, the communication strategy is not considered about those cultural issues. Our culture is not also fit for accepting those health messages or health issues from the concerned body. That, like that I told you, for example, we trust just traditional medicines, especially in the rural parts.
How do you evaluate the job of mass media in communicating COVID? Because mass media are by far the most important element as far as communication is concerned. So how do you evaluate the job of the media, Ethiopia media?
I think media is the most powerful tool on earth.
Yeah.
In the information age.
Yeah.
Especially TV is the most impactful medium that try to address the audience by many elements. Yes, because of its interactive behavior, media, especially the TV, has a role to communicate, a tribal way of communication.
Yeah.
That means it is like personal communication. You see people's, you listen people's. So the audience try to interact directly to the media personnel. So having this, the role of the media in Ethiopia was, I think, should be acknowledged in terms of especially providing information and giving government daily briefing and scientific research presentation. It was, I think, a very nice practice. It should be done even to any other development practices like what we have done to this pandemic. We have to take a lesson from this pandemic, how to campaign against certain challenge and the risks against the society. So, but what was the gaps were, I think, the information was not regulated well. Any production come from any body was broadcasted. We have seen a number of clips, music clips, drama, and any other productions that was aired to the society without being filtered and managed. For example, initially, the media terrified the society. Because of that, some people try to escape, not to be quarantined, because the information was terrifying.
Yeah.
Finally, it comes to dramatized and become more funny than terrifying.
Yeah.
So the information would be good if it was regulated. It was led by health experts than anyone. Any journalist was reporting COVID. Any journalist was make analysis on the pandemic. I think it was not a good practice for that. There should be a specialist or a beat reporter to health issues. Media should assign analysts and reporters to some areas like health and education and other areas to be analyzed by specialists and general reporters. So because of that, because of our different understanding towards the virus and perspectives, the information come out from the media was somewhat mixed, sometimes confusion. So even if we have to acknowledge its effort, its campaign, its sustained commitment toward addressing the society, but the information was somewhat mixed, unregulated, and sometimes unprofessional. So the media, I think, will take lesson from this practice to any other crisis that may come to our world.
Yeah. You have raised critical critics regarding the role of media in communicating COVID. Let me come to you, Haimanot. Do you have something to add regarding the job of media in communicating coronavirus? What were the weakness and the strengths of Ethiopian media in communicating the virus?
Yeah, as Mulikan mentioned that, I think media play a major role what they were doing so far. It is a campaigning program. In every media outlet, television, radio, and other media outlets, they are doing what they feel from taking information from the concerned body. As Mulikan mentioned, there was a big role they play. We have to appreciate what the media is doing. If you are doing the same thing for other health issue, I think it will be better for the future too. Because it's the first time for the media doing such eradicated campaigning program, especially in our context here in Ethiopia. So we have to appreciate what the media were doing. But related to about the beat report, what Mulikan mentioned, here in Ethiopia, for example, we don't have a beat reporter related to, for example, health issue. Everybody can, for example, describe COVID. Everybody says something about COVID, but it is the issue of the health professionals. Most of the information is getting from the political leaders instead of health professionals. But later on, in the middle of the corona or at the end of now at time of the moment, media may invite those professionals from the health issues. But at the very beginning, it was the issue of the politics, and also were not yet evaluated the message. Mulikan mentioned that those information even frustrate. People are not at the very beginning. Even the journalist, while he is reporting the health issue, the COVID issue, was frustrated. If you frustrate first, then the people also follow you. Yeah. That was a very challenging problem. The same is true when you just invite those clips and other comedial program. They simply take from any agent, from any communicator agents. They simply playing in their television station and their radio stations, and people listening. Even after nowadays, people are just dancing with COVID because of the music. So that should be evaluated. But for the time, it was good. We have to learn. We will have a number of challenges, health challenges for the future. So it should be the starting point. We have to learn. But not only for the media, by the way, it is a concerned body. We have to give, I think, a regulated message for the media. Yeah. Not only for the journalists or for the media, the concerned body, like the Minister of Health also should give a regulated message for the media. And then the media also give information for the public too.
Yeah, media is a double-edged sword.
Yeah.
If we rightly utilize the potential, we can bring about change. Yeah. And if we utilize it in the wrong way, we can damage the society. And you have explained it in the best possible way, I think. So we have
add more on that point.
Exactly.
Some pointers.
Yeah.
I think in terms of crafting the message, the media was assuming the society as homogeneous. But the society is not like that. We have a heterogeneous society. Economically, in terms of education level and professional status, the society is heterogeneous. So when we design messages in the media, we have to assume, we have to try to understand the society. What is the society? So, yes, we have to design message for children, special to children, and we have to select times which is suitable for children. We have to design a message for farmers, specific to farmers. That is a tailored message should be designed to each targeted population. But the message designed was I think the same for all societies. The other gap I have observed is I think the media aired drama, farmer-oriented dramas. But do we think that how many of our farmers do have TV at their home? I don't think so. Maybe 1% or 0% of our farmers have that. So why don't you use the appropriate channel to the farmers? Why don't you segment the channels we address the society, and why don't you draft kind of message that's specific to the audience? We can't assume the same message addresses to everyone, can be accepted by everyone. We have to be specific to each groups, to farmers, to urban, to rural peoples, to maybe home wives and others. So the media looks at people in the general way than in a specific, in a categorical way.
Yeah.
Maybe to add one more. Actually, he already mentioned Orient segmentation. In communication, there was a term, Orient segmentation. We have to segment, or we have to divide the audiences or the peoples based on about their level of awareness, as well as they are near to what media the people are near. For example, there is a television station for urban and interpersonal communication, or radio for the rural peoples. But in the case of our context for COVID, it was not done. One thing. And the other one is there was a mixed language. Even we cannot, there was not anyone who translates COVID in Amharic. At the first, there was translate, I think, Yesamba Kollef in Amharic.
Okay.
But still, people are using COVID. And the other one is, I think, mixed language. We mix it. Jargons also. Jargon. Most of the time, people may lead wrongly if we use those jargons, and using an appropriate jargon were also a challenging problem for the journalist. Actually, this is not only journalist. It would be better if you translate by those health professionals, if you give their job.
Okay, so we have commented the government, the media, and even the culture of our people. So what should be done next is my question.
Okay. The first thing we have to do is we have to have a communication strategy that will work to crisis and that will work to the day-to-day activities. So communication strategy is important. In designing communication strategy, I think basic steps is important. The first one, we have to make a research that is important to our society. What kind of communication approach tools are important? We have to make a research that goes with our societal behavior. We can include folk or traditional way of communication in Ethiopia case. It may not work for Europeans, but we have to make a research that to come up with a strategy that suits Ethiopian society. The second, we have to assess the impacts of crisis like this pandemic, and while assessing that impact, that enables us to indicate the necessary resources, the necessary human resource and other material resources. We have to have a contingency budget for crisis. So in order to have that kind of budget, we have to able predict the impacts of crisis. The second one is we have to design how to implement a solution against the impacts or the pandemics. There should be kind of implementing. It can be an action plan. What we'll do at the beginning, what we can do in the course of the pandemic, and how we can even communicate post this pandemic. It is very important. The final one is we have to evaluate what we have done, the effectiveness of our communication, or or we have to identify the gaps in our communication approach, because that gives us a lesson to the other round. So our practice in this pandemic, I think, give us a good lesson.
As Mulkan mentioned, there should be a communication policy here in Ethiopia. We have not a communication policy, especially the health issues. So from the communication policy, we should have also a communication strategy. So the journalists, the community leaders, the government, and the other concerned will follow this communication policy. There should be also interrelated, or what do you call it, there are different stakeholders. There should be integrated, those stakeholders, not only working for the journalists, for the media, or for the health professionals. Everybody should be part of this COVID problem, because it's a national crisis, not only a global crisis. So we have to integrate it. The other issue, there should be the government also should be trust. For example, at the very beginning, no one is allowed to just have a meeting or living together or have something, a final ceremony. But the government was doing like a meeting. There was a big conference. There was a big demonstration in all the country. So the government should be also trusted. And the journalists also try to put the messages from health professional view. There should not be terrorizing the people. At the very beginning, maybe people may terrorizing, and after all,